night of the soul? Is this something in our brain? Is it something in a different dimension?
Best way that I can be fulfilled is if I care for you.
Hello and welcome to this week's episode of the Fulfilled series. Today we have with us a clinical professor of psychiatry at Columbia University, Dr. Drew Ramsey, who also is the author of Eat Complete, the 21 nutrients that fuel brain power, boost weight loss, and transform your health. This book is a wonderful gift to our profession because Dr. Ramsey really looks outside the traditional bounds of psychiatry and starts integrating psychiatric principles with important nutrition. So I have patients come to me all the time saying to me, I have depression, anxiety, whatever it is, and I don't want to be on meds. And they're looking for so many other alternatives to traditional medication as ways of healing themselves and really connecting sometimes to the deepest part of themselves. Can you tell us about your book and what you do with patients like that?
Thank you, Dr. Ann. It's really good to be here with you. So it seems that nutrition is maybe a bit like spirituality in the sense that we know it's very important to psychiatry. Right? The brain needs vitamin B12 just like the spirit needs to soar. And it's something that we don't talk about very much in our office and in our profession. So nutritional psychiatry has really come along over the last 15 years thinking about all of the evidence that relates how we eat and our dietary pattern to our risk of illnesses like depression and dementia. We're sort of in psychiatry a little bit the bastard stepchild of medicine, that we think about health and food, we think about heart health, we think about diabetes, we think about cancer risk. Those are all obviously very important parts of how we make decisions about what we eat. But the data on mental health is really quite striking, and it's important, I think, for a number of reasons. First, let's just talk about disability. The top driver of disability worldwide is depression. And so we want really all hands on deck. And let's have food be a part of that. Let's have movement be a part of that. And maybe if you need meds, okay. I also, like you, do a lot of psychotherapy. But I really wanted to help people with this book get the food right. And so Eat Complete, and then our recent e-course, Eat to Beat Depression, is all about giving patients tools. Because so many individuals either are struggling with their mood or know someone who is. And so the hope is people begin to think about certain, what we call nutrient-dense foods. And so I'm sure you have some favorite mental health nutrients that you like?
Yes. Folate, vitamin B12,
all right,
omega-3s.
So the whole goal of some of this work is, okay, we know that, how do we translate that into what are the top food sources? So vitamin B12 is a great example. Vitamin B12, the top sources are going to be bivalve, things like mussels, clams, and oysters. And that's not a dietary recommendation people get very often, but mussels, very inexpensive way to add lots of B12, but also other things like omega-3 fats into your diet. And so we look at those key nutrients, and here we go through 21 of them, things like magnesium and omega-3 fats, and to talk about what are the real take-home points around mental health. And then to give you the top food sources. And so that's how Eat Complete's designed. We go throughout the nutrients and try and offer up ways to think about the foods that have the most of those nutrients as really being foundational to your diet.
Dr. Drew, how did this become your focus?
Well, I grew up on a farm in Indiana, and I think like a lot of us in professional life, I thought that these personal kind of elements, being an Indiana farm boy, and my professional life, being a New York City psychiatrist, those were very different. But I think like a lot of people come to understand professionally, that the more we kind of integrate ourselves and, as you say, get to an authentic place, the better we feel. And so increasingly after we had kids, I was spending summers on the farm with my folks and with my wife and our young kids, and just really love the feeling that it gives me growing my own food and being on a farm. And there's a clear miracle at work, I think, when you put a little tiny seed in the ground and then you get this big plant full of food and more seeds for next year. And so as I've spent more time on the farm and now splitting my time between Indiana and New York City, I feel very blessed to be in the presence of nature at work. And I find a lot of satisfaction and a lot of spiritual guidance, I would say, within my forest and with my hands in the dirt, where you see so much bounty and beauty happening. And so I guess that somehow informed this book.
Where beautiful.
Just something really wonderful that also happened when I started talking about to patients about what they ate. Because we don't get trained to do that. And it was really interesting. It reveals this whole kind of aspect of how our patients organize themselves, how they think about wellness and nourishment, how they partner with their community, things like how do you access food? And we still have lots of goals about, helping you sort out issues with your mom and with yourself. But it was a nice thing for us to check in and talk about sort of how do we help shape someone's diet. And so that's really what we've focused on clinically. I still sort of do a lot of general psychiatry, but now have a health coach and a therapist who really tries to meet with patients and actualize dietary change very rapidly. We're big on rapid behavioral change. How do we really get your eating tuned in?
How do you do it rapidly? What's the formula?
Well, I think our first step of our formula is we try and really dive at these problems with a lot of love. That we talk a lot about food joy, and that we don't want to approach food the way that so often people have in the past. It's a fearful thing, right?
Yeah.
Be scared of cholesterol, be scared of fat, don't eat this, don't eat that. And we really don't like that. We're very joyful eaters. And what we try and do is understand where people are and what their goals are. Maybe your goal is you want to eat fewer sugars and carbohydrates. Great. How does that translate to lunch? So we get very granular in terms of our goals, and we assess people's diet through what we call food categories. So instead of thinking, do you eat a lot of wild salmon, we think, what's your relationship like with seafood? And if you think most of our interventions end up helping people eat more plants, that most of what we prescribe are plant-based diets. We want people to eat very carefully selected seafoods and meats and other sources of protein, but to really help folks, I think with that plant question is like our first step, because so many people are really just struggling with that aspect.
That's so interesting. It sounds like you meet people where they're at. You're not prescribing necessarily a specific kind of diet, but some general principles that you allow people to integrate into the diets that they have.
It's that farm boy powder for me. I like stuff that works.
Yeah,
and I
very
find
practical.
that when you really radically change people's behaviors quickly, they can adopt those behaviors, but they don't last. And what we find very fulfilling is when people come back 6 months later, a year later, and you've really changed how they eat.
As I understand it, your nutritional program and nutritional psychiatry is really helping people to become more whole and more authentic, helping them to connect to who they really are and actually align with foods that are more joyful for them, that feel, that are in line with their cravings, but also in line with general positive principles of well-being, of wellness, of, upping the nutrients like B12, folate, etc., that have been shown to be in psychiatry beneficial for depression, for anxiety, and things like that.
The hope is that the diet can be medicinal for people or helpful for people, and really no matter where you are on the mental health spectrum, as we say, like everyone has a brain. No matter what your genetics or risks are for other illnesses, we know that without enough iron, vitamin B12, omega-3 fats, you're just going to have a higher risk of all sorts of problems with your mental and emotional health. And it is, I think it's something I also encourage clinicians to add into their practice, because it's not that complicated, but it's very, I think, alliance forming. That in the midst of so much that we really struggle to change about our lives and our patients struggle to change about their lives, the notion that you do have control of dinner. You really do. You do have control of what you're going to have for lunch, and that's a choice that you make. And to help our patients think about that choice creatively and broadly and make a choice that really feeds their brain.
How would you work with someone like that?
Well, so I'd get very curious on what happens during the day. And curious about when this behavior changed. At some point, these individuals went from eating 3 meals a day to eating one giant, gluttonous, wonderful feast at the end of the day as a reward. So I'd get curious about when it started, what the psychology of that reward is. And oftentimes you hear during the day there is a denial of the self. I treat a lot of folks in New York who are out at events, and so there's a big difference between a glass of wine and a really nice meal of wild salmon and some quinoa and kale, right, which is available in pretty much all restaurants, and maybe skipping dessert. That's a very wonderful way to wine and dine clients, but somehow that's not wining and dining, even though it included those two things. And so helping people with some moderation, although I generally tend to avoid that, everything in moderation advice, because I don't find it to be very helpful or specific. But to really schedule out some of, with that individual, where are they doing their entertaining? How can you boost up the health quotient of that place? To really think through with you, what are some meals you felt really great about while you were taking clients out? And what are some choices you made that you don't feel so good about? To really kind of get into that basic motivational interviewing mindset of helping the individuals in front of us really tap into their own motivation and their own joyfulness around food and sustenance, and then work out a plan that feels good to them and most importantly is very feasible.
So Dr. Drew, How has the psychiatric profession responded to your work, which is so important and also reflective of what patients, at least in my experience, are asking for more and more?
You know, I've been very blessed. I've had a lot of support from lots of colleagues at Columbia and also at the American Psychiatric Association. Just be very enthusiastic about the conversation and bringing food into that conversation. We've had workshops with Dr. Emily Deans, who has a great blog, Evolutionary Psychiatry. There's been, I think, caution in some ways that psychiatry is a little guarded, that there's concern somehow that when you want to talk about zucchini, it means that somehow you're not into Zoloft. And I really try and keep the conversation about food, that no matter what people need in terms of meds, in terms of psychoanalysis or therapy or CBT, we know that every brain needs a certain set of foods. And so I think that the field is very tuned into that. I think it's also nice for us because it's a way for us to engage the public about brain health that doesn't involve our typical concepts about mental health and psychiatry. That people think about us in terms of meds or maybe talk therapy, and the notion that, look, we can be involved in your life 3 times a day at mealtime. I like that notion. I like that we're really thinking kind of 360, how do we help individuals improve their mental health, and how do we engage the public around brain health in a way that gets people curious.
So Dr. Drew, you have a paper coming out in World Psychiatry about antidepressant foods. What are antidepressant foods?
So these are foods that have the most nutrients that science tells us relate to the illness of depression. So this is a really fun paper. It's a nutrient profiling system. So there are 27 nutrient profiling systems that exist in the world. None of them have to do with brain health or mental health. And what nutrient profiling systems do is we highlight certain nutrients and say, these are really important for this illness process, and then try and find the foods that have the most of those nutrients for the fewest number of calories. So that's a nutrient profiling system. We noticed nothing had been done in terms of mental health. And so Dr. LaChance and I did a systematic review of the literature, pulled out all the data that related to depression and different nutrients, specific nutrients, and found that there were 12 of them that had really substantial evidence, both observational, epidemiological evidence, but also clinical trial data, that these are nutrients that you don't have enough, boy, your risk of depression goes up, and hey, when we give it to folks, their depression gets better. What are the foods that have the most of those nutrients? And so that's what Antidepressant Foods out. It's coming out in the Journal of World Psychiatry, and we just, again, look forward to getting that conversation going. And people think like, oh, we should only eat these foods. No, this is in part to help us have a conversation around which foods are most important for mental health.
That is so cool. And tell us about your e-course about antidepressant foods.
Well, thank you for asking. So the e-course is Eat to Beat Depression. And we just found a lot of people were asking us, look, what are some foods that I should start eating? What are some nutrients I should start eating? I have a sister who's depressed. I want to help her in some way. And so we wanted to create a really simple digital product. So these are a series of videos. It's a course that helps people understand the latest science in terms of how brain health relates to food. One big concept for folks often is neuroplasticity, this idea that what we eat influences our brain growth and brain health over time and helps our brain kind of better repair itself. So we'll go over some basic concepts like that. The most recent science, stuff like the SMILES trial, a couple of interesting randomized trials that looked at prescribing individuals with depression the Mediterranean diet and found that they really did quite well. And then to get into the nitty-gritty about a couple of nutrients, and then my favorite part of the course is goal setting. Okay, great. Let's talk about the seafood category. How do we really help you think about where you are, what seafood you like, and then how are you going to get more of that in your diet over the next couple of weeks? And so that's the course. People can check it out on my website, drewramseymd.com, and we have a Facebook group that kind of supports it, and so it's a really nice community to help people, again, actualize this notion of prioritizing your brain when it comes to your dietary choice.
That is wonderful, and I'm going to recommend that to my patients. So thank you so much, and thank you so much for being here today and taking the time to share your amazing work with us.
Well, my pleasure. I look forward to working more with you, and I think
Likewise.
Arm in arm, the future of psychiatry looks bright.
Beautiful. Completely agreed. Thank you.